This is Kathy Knipfer, instructor for Nursing 2313, recording the Community-Based Nursing Lecture for Chapter 2, Health Promotion and Disease Prevention. With respect to health and illness, community-based care concentrates on true health care activities that promote health and prevent illness and injury. There's a shift in thinking from a focus on sick care to disease and injury prevention. In 1986, the World Health Organization defined health as a state of physical, mental, and social well-being, and not merely an absence of disease or infirmity. The World Health Organization updated that definition in 2008 and included characteristics, behaviors, and the physical, social, and economic environment. Considering health rather than illness as the essence of care requires a shift in thinking. The health-illness continuum illustrates this model of care. In the community, care focuses on maximizing the individual potential for self-care. The client assumes responsibility for healthcare decisions and care provision. The client's ability to function is the primary concern. Care in the acute care setting is usually directed to resolve immediate health problems. Healthy People 2020 has 5 missions. The first is to identify nationwide health improvement priorities. The second is to increase public awareness and understanding of the determinants of health, disease, and disability, and the opportunities for progress. The third is to provide measurable objectives and goals that are applicable at the national, state, and local levels. The fourth mission of Healthy People 2020 is to engage multiple sectors to take actions to strengthen policies and improve practices that are driven by the best available evidence and knowledge. The fifth mission is to identify critical research, evaluation, and data collection needs. You should refer to the focus areas on page 34 in your textbook. Healthy People 2020 also has developed overarching goals. The first is to attain higher quality, longer lives free of preventable disease, disability, injury, and premature death. The second is to achieve health equity, eliminate disparities, and improve the health of all groups. The third is to create social and physical environments that promote good health for all. And then the last one is to promote quality of life, healthy development, and healthy behaviors across all life stages. Now let's discuss the concepts of health promotion, disease prevention, and health protection. Health promotion includes activities that help the individual change their lifestyle to move toward a state of optimal health. This would be a balance of physical, emotional, social, spiritual, and intellectual health. Disease prevention includes activities that are undertaken to avoid the occurrence of a disease or injury and minimize the consequences. These activities are intended to prevent future illness. Health protection involves environmental or regulatory measures that confer protection on population groups. Nurses can help reduce health disparities by educating themselves regarding issues of disparity, by using evidence-based decision-making, by identifying vulnerable populations in the community, by helping clients pursue high-quality care, and by advocating for vulnerable populations. Levels of prevention. Primary prevention is described as prevention of the initial occurrence of a disease or an injury. Secondary prevention involves early identification with prompt intervention to prevent or limit disability. Tertiary prevention involves assistance to halt further disease progression and to meet one's potential and maximize the quality of life. The interventions included in the Public Health Nursing Intervention Wheel are listed in Table 2-5 on page 43 and 44. An example of an intervention included in this wheel is advocacy, where the nurse would plead someone's cause or act on someone's behalf. The public health intervention model, or wheel, includes levels of public health practice. The first is individual focused practice. This practice changes knowledge, attitudes, beliefs, practices, and behaviors of individuals. This practice level is directed at individuals alone or as part of a family, class, or group. The individual receives services because they are part of the population at risk. The systems focused practice of the public health intervention model changes organizations, policies, laws, and power structures. The focus is not directly on individuals and communities, but focuses on systems that impact health. It is a more effective and long lasting way to impact population health. The community focused practice on the intervention wheel changes community norms, community attitudes, community awareness, community practices, and community behaviors. It is directed toward entire populations, groups within the community, or target groups. Effectiveness is measured in terms of what proportion of the population actually changes. Population based interventions include all levels of practice. They are represented by all three inner rings of the intervention wheel. The interventions may be focused on the population or on individuals and families known to be at risk. The public health interventions, along with definitions, are listed in Table 2-5 on pages 43 and 44. Surveillance is the first one, which involves monitoring health events through ongoing and systematic collection, analysis, and interpretation of health data, and this would be for the purpose of planning, implementing, and evaluating public health interventions. The second one is disease and other health event investigations. That one is a little bit more specific. It focuses on threats to the health of the population. It ascertains the source of the threat, identifies cases and others at risk, and determines control measures. With outreach, populations of interest or populations at risk are located, and then information is provided to them. Screening identifies individuals with unrecognized health risk factors or asymptomatic disease conditions in populations. Case finding locates individuals and families with identified risk factors and connects them with resources. Referral and follow up involves assisting to identify and access necessary resources to prevent or resolve problems or concerns. Case management optimizes self care capabilities and the capacity of systems and communities to coordinate and provide services. Other public health interventions include delegation functions, where direct care tasks are carried out under the authority of another. Health teaching communicates facts, ideas, and skills that change knowledge, attitudes, and values, and beliefs, behaviors, and practices of individuals, families, systems, and/or communities. Counseling establishes an interpersonal relationship intended to increase or enhance their capacity for self-care and coping. Consultation seeks information and generates optional solutions through interactive problem solving. Collaboration commits two or more persons or organizations to achieve a common goal. Coalition building promotes and develops alliances among organizations or constituencies for a common purpose. Community organizing helps community groups identify common problems or goals, mobilize resources, and develop and implement strategies for reaching the goals they collectively have set. Other public health interventions include advocacy, where the nurse pleads someone's cause or acts on someone's behalf. Social marketing utilizes commercial marketing principles and technologies to influence the knowledge, attitudes, values, beliefs, behaviors, and practices of a particular population. Policy development places health issues on decision makers' agendas. Policy development results in laws, rules and regulations, ordinances, and policies. With policy enforcement, the nurse compels others to comply with the laws, rules, regulations, ordinances, and policies that have been created with policy development. In summary, nursing practice has evolved as a reflection of society's need to focus on health rather than illness. Healthy People 2020 provides a framework to put disease prevention into action. Prevention is a key concept in community based care. Question number 1. Student nurses go into a neighborhood door to door. They identify individuals who have not had flu shots and direct them to the local community center's flu clinics. This is an example of A. Screening, B. Outreach, C. Health teaching, or D. Surveillance. The answer is B. Outreach. The rationale is that outreach is locating populations of interest or populations at risk and provides them with information about the nature of the concern, what can be done about it, and how services can be obtained. Question number 2. A nurse meets with Edna, an elderly woman who has been hospitalized with a broken hip, and her family. They discuss what self-care Edna can manage on her own and how the family may be able to assist her once she goes home and determine the community resources available to assist with her care. These actions would be considered A. Health teaching, B. Case management, C. Collaboration, or D. Case finding. The answer is B. Case management. Case management optimizes the self-care capabilities of individuals and families and the capacity of systems and communities to coordinate and provide services. Question number 3. The nurse is providing blood pressure screening at the local senior center. This is an example of which level of prevention? A. Health promotion, B. Primary prevention, C. Secondary prevention, or D. Tertiary prevention. The answer is C. Secondary prevention. Screening is considered secondary prevention because the nurse is identifying the presence of a disease.